Hi everyone, it's Kristen Digwood from Elite Pelvic Rehab, and I'm stealing a couple minutes away from the clinic in order to talk about the pediatric population. Typically, we see children for bedwetting issues, urinary and fecal accidents. We've been getting a bunch of emails from concerned parents who have children who have already potty trained. They may even be 5, 6, 7, even 9-year-olds, 12-year-olds who just out of nowhere started to have bedwetting issues. And the common question that people are asking is, what is the first thing I should do? Give me some guidance so that we can overcome this. Obviously, the first thing you want to do is go to see your doctor, have them run any kind of tests they need to run, see if there's any other underlying causes at play. From there, we see many children in physical therapy. And the first thing from a generic standpoint we look into is constipation. I think that parents are baffled with this because constipation in children is defined a little differently than it is in adults. Children can have a bowel movement 2 or 3 times a day and still be classified as constipated, whereas adults, this isn't typically what we would see. If adults are having 2 or 3 bowel movements a day, they typically are not constipated. Also, constipation in children can go on a lot longer than in adults. So it takes about 6 months to a year for them to have this constipation put behind them, meaning most of the time you'll have to be consistent with the things you're doing to treat constipation, even in the absence of true constipation signs in the moment. Children heal differently. They need more time for their system to readjust. Many parents will feel that, oh, my child's had a really good week with it and it's not an issue. I'm going to take them off the medication or stop whatever program was in place, and this is a mistake. Constipation will cause urinary accidents in children. It will cause bedwetting issues. If you look on imaging and you see the child's constipated, and some imaging you can actually see the pressure of it pushing on the bladder, which in turn causes these accidents. So we need to be diligent in clearing that up. There's a bunch of things we do in physical therapy to clear it up, from controlling the pelvic floor to changes in habits to different exercises. But to briefly address that question, parents, the first place you should look after you've been to the doctor is constipation.